Hi, everyone. I'm Seeni, and I'm a third-year pediatric resident at Children's Hospital Los Angeles. Thank you for your attention and the active discussion. It's been really wonderful and engaging. I will be discussing today specific policy changes that we should be advocating for globally in order to address some of these consequences of climate change that we have been discussing so far today. This discussion will also include a summary on root cause analysis of these key issues and how to build resilience. I think the graph that Adith had used earlier was a lot nicer than this, but I think we have drawn a lot of or basically just demonstrated how climate change is directly contributing to poverty, migration, gender inequity, and health consequences. And all of these issues are contributing and cyclically worsening each other. So we definitely have to be addressing all of these issues, and climate change, one of the primary driving factors. We know that climate change is leading to an increased frequency of natural disasters. These are cyclones, floods, hurricanes, droughts that we have been discussing. And this leads to a lot of destruction of infrastructure. And this is a key contributor to migration and poverty. The loss of infrastructure includes and is not limited to the loss of homes, employment, agricultural lands, and thus income. It also leads to the loss of food security, and loss of schools, and thus the loss of education. We know that the vulnerable populations include women and children and the poor class. But as Dr. Kraft mentioned yesterday as well, at least from Central America, we're seeing a bigger migration of the middle class, as they're the only ones able to actually afford to migrate. We also see, as Adit just discussed, how climate change leads to increased social and economic pressures, and how women are disproportionately negatively impacted. These financial burdens cause women to be withdrawn from school and take on more household responsibilities. Furthermore, the limited resources, migration, and then additional psychosocial mental health stressors increase the risk of abuse, exploitation, child marriage, and the trafficking of women. And lastly, we know that migration, poverty, and gender inequities all contributing to less access of healthcare. We know that extreme weather changes contribute to poorer health outcomes, and these include maternal and neonatal health outcomes. I'll talk a little bit about my background here. I'm actually also an academic researcher, and I spent 2 years researching at the NIH prior to going to med school. And the key goal of my lab group was looking at the environmental impact on maternal and neonatal outcomes. My specific interest was pediatrics, so I looked into neonatal outcomes. And we saw a lot of effects of, one, air pollution, increasing risk of pregnancy loss, stillbirth, increasing the risk of preterm labor, which also has further consequences down the line. We have increased risk of NICU admissions, and this also is. We also saw this one with air pollution, but also increasing extreme temperatures, rising ambient temperatures. And furthermore, it's not just with that acute finding that we have with rising temperatures, air pollution during pregnancy and related to one pregnancy. We also saw that this was having effects on future pregnancies. So we're seeing there's definitely a lot of maternal and neonatal outcomes that we're still exploring, but we know it's there. With regards to the children, we know that there's an increasing incidence of asthma and worsening asthma exacerbations. This is an ongoing problem we're seeing. And beyond women and children, we know that the older population is also quite susceptible and have increased mortality with a lot of these extreme weather changes. Furthermore, what we know that climate change is increasing the incidence of waterborne disease, tropical and vector-borne disease, and zoonotic diseases. Waterborne diseases are becoming an increasing issue due to sanitation issues caused by the destruction of infrastructure and flooding. This increases the presence of parasites and other viruses that cause significant GI disease that can also lead to mortality. Vector-borne and tropical diseases include Lyme disease, dengue fever, malaria, as earlier presentations discussed. But we also know that, for example, in Alaska, where temperatures are rising at twice the rate of the United States, there's also the greater prevalence of other animal-related diseases like brucellosis, toxoplasmosis, giardia, rabies, and tularemia. And lastly, we also know that warmer weather leads to the longer survival of these vectors, parasites, infected hosts. And this leads to increased opportunities for the transmission of disease from animal to human. We refer to this as the increasing emergence of zoonotic disease. And some prime examples of that are COVID. And prior to that, the avian flu. So these are things we are actively seeing an increased presence of these infectious diseases and undeniably are going to continue to see. So that brings me to where we should be going for policy. And there are three key areas that we encourage governments to institute policy changes for. And those are social programs, gender equity, and into public health. For social programs, a key thing we are recommending is investing in sustainable infrastructure. This includes increasing groundwater reserves in areas susceptible to drought, planting additional trees, and roofing in areas affected by higher temperatures to prevent overheating and energy costs, increasing sewage in areas affected by flooding, and building housing that can better withstand hurricanes or cyclones. It is estimated that for $1 million of investment in climate resilient infrastructure, we could be saving $4.4 million in post disaster relief. If that is not a sufficient argument enough, and that the cost for initial investment is still a barrier, there is the Disaster Risk Financing Program of the World Bank Group that hopes to mitigate this barrier and will provide financial assistance for climate change directed government initiatives. We also recommend the investment of governments into food and shelter programs for displaced families. And this is also in hope of preventing children from entering the workforce. We have seen success in this, as well as success in incentivizing education to help ease the familial burdens. Examples of incentivizing education is giving families checks for sending their kids to school or providing meals at school. There's been a lot of success for this in South America and can both benefit families and benefit children. We can also use these food and shelter programs to serve as a way to educate children and families, to recognize warning signs for extreme weather events, to then implement measures for risk reduction. And this is teaching families resilience to provide another layer of protection against climate change. In terms of gender equity, as I think we were talking about earlier, we have seen that the increased government representation by women has improved climate change policies in both Asia and Africa. And countries supporting women's empowerment has a 55% increase in food security. We thus call for governments to improve political rights which include land ownership, a role in government, and protecting these rights, as this can all contribute to increased gender equity and thus equal improving resilience of a country. We know that investing in equity and women's education is this resilience. It contributes to less abuse, early marriage, less femicide, less trafficking. And this investment in equity thus increases our workforce that leads to economic growth. And this overall economic growth further combats all the issues we're seeing by battling poverty and supporting climate change infrastructure and health outcomes. We also have seen that in countries where women are more taking on a larger role in the government, that they are inherently able to drive these policies for climate change better, and thus further advance overall country's response to climate and resilience to climate change. And lastly, we call for an investment into healthcare. And this is, of course, includes, but it's not limited to mental health, migration, disease surveillance, into research and public health campaigns on the emergence and transmission of infectious disease. And we also call for an interdisciplinary and international collaboration, because what we see in one country definitely applies to other countries too. We're seeing these consistent patterns. And examples of ways to focus efforts on the prevention of disease includes increasing PPE, or personal protective equipment, in areas that are higher risk of emergence of disease, and public health campaigns that include supporting and providing malaria nets or water sanitation efforts or education in disease transmission. And these are all things that can improve the health outcomes that we are seeing. It is estimated by 2030 that direct healthcare costs from climate change are estimated to be 2.4 billion annually. And that doesn't even include the cost to human life. So to conclude, we have demonstrated that there are undeniable effects of climate change on children, women, and societal health. And there's an ethical imperative for governments to invest in sustainable infrastructure, social programs for children and families, into gender equity, and into public health to mitigate the consequences of climate change on human rights and health. Thank you for your time.